Hey everyone, welcome back to Clinical Physio with me, Khalid Maidan. Here's our top 5 tips for rehabilitating lateral epicondylitis, also known as tennis elbow. Top tip number 1. Find the activities aggravating your patient's tendinopathy and then manage them. Aggravating factors linked to lateral epicondylitis often include gripping or twisting with load. Like with all reactive tendinopathies, it is important to advise your patient on changing the frequency of activity, duration of activity, speed of activity, or load being used in said aggravating activity in order to help reduce the irritation being placed on their tendon. So for a manual labourer whose tendon is being irritated by lifting manhole covers, perhaps reducing the number of lifts, the speed of the lifts, or the length of time that he lifts the covers per day would be beneficial. Top tip number 2. Consider isometric exercises early in your patient's management. Evidence shows that isometric exercises are effective in relieving pain stemming from inflamed tendons. Thus, isometric wrist extension, as shown here, where the lower wrist is the one being exercised, would be suitable. Make sure, though, that your patient only pushes as hard as their pain allows when performing the isometric. Top tip number 3. Do you use eccentric exercises or concentric exercises? Well, actually, the answer may well be both. Firstly, it's worth investing time in eccentric loading exercises, as you can see here, where the unaffected hand would support the affected hand into wrist extension, before the affected hand lowers the weight downwards. Whilst eccentric loading is not considered to be the be-all and end-all in relation to tendon rehab, as perhaps suggested in the past, it is still an excellent method of reloading your patient's tendon. But then again, don't be afraid of concentric wrist extension exercises either. Tendon rehab is all about a gradual loading program, in which the tendon in question needs to be retrained in order to be able to cope with the demands required of it on a day-to-day basis. Too often I have had patients attending clinic having completed eccentric exercises, and then going back to their work or hobbies in which the extensor tendon has to work concentrically, and has suffered as a result because the tendon has not yet been rehabilitated to do what it fully needs to do. Concentric exercises may not be completed early on in rehabilitation, but they definitely need to be included later on. As for the weight to be used in these exercises, progress gradually and make sure that your patient's symptoms are not over-irritated with the weight being used at the time of exercising, later that day, and 24 hours later. Top tip number 4. If you find you have been rehabbing the wrist extensor muscles with no progress at all, or if you find that the wrist extensor muscles are very strong as well as painful, this may be because the muscles and tendons are working too hard because something else nearby is not. For example, an insufficient anterior deltoid may cause your patient to grip more aggressively, which over time can lead to overuse of the wrist extensor muscles. So if your patient's progress appears to be poor, it may be worthwhile checking other nearby joints, including the shoulder, to find out the weak link that needs to be strengthened in order to support your patient's overactive wrist extensors. And finally, top tip number 5. If your patient needs to get back to the same activity that irritated their tendon in the first place, advise them on ways in which they can implement a graded return. So let's go back to our worker with the manhole covers. So if they've been off work but need to get back to lifting 30 covers a day, which each weigh 10 kilos, you may suggest they could try to return to lifting 15 covers a day, and then gradually increase to 20, then 25, then 30. Perhaps you may suggest they start by only lifting the lighter 5 kilo covers before moving on to the 10 kilo ones. There will be lots of different ways of doing this, but whatever option you choose, make sure this is in line with your patient's ability and comfort levels, i.e. not giving them too much too early, which may inflame the tendon again. It's not just the exercises which are key. Your advice on your patient's activity levels may be the final piece of the puzzle. So there you go, that's all from me. Thank you as always for watching, and for even more great tips, join us again at clinicalphysio.com.